For joining us for What's Happening in the States. I'm John Hoffman, Senior Director of State Policy and Advocacy at the American Kidney Fund, and I'm here with my colleague, Ari Holland Baldwin, Associate Director of State Policy and Advocacy. During our session, please type any questions in the chat, and we'll try to get to as many as possible. We have a few videos to start our presentation with. The first video we have here is a message from Assemblymember Pamela Hunter from New York, who AKF worked closely with on a biomarkers bill this last year in New York State.
Hi, I'm Assemblywoman Pamela Hunter of the 128th Assembly District in New York State. It's an honor to be joining you for Kidney Action Week. Every year, thousands of people die from kidney diseases and cancer. Yet one of the most important ways to prevent death from kidney cancer was out of reach for many New Yorkers until recently. Last year, I sponsored legislation that was signed into law that requires state-regulated insurance plans, including Medicaid, to provide coverage for biomarker testing. Prior to my bill being signed into law, 2/3 of oncology providers who responded to a survey cited insurance coverage as a barrier for their patients to receive biomarker testing. These tests are crucial to help determine whether cancer is likely to spread and what the necessary precautions and preventative steps to take are. Securing coverage for biomarker testing is a big win because it's essential for accessing targeted therapies that can improve survivorship and a cancer patient's quality of life. It's not just cancer either. Patients with other illnesses, including chronic kidney disease, can also benefit from biomarker testing, which allows for more targeted treatments. Ensuring access to biomarker testing will save lives and massively improve patient quality of life. I want to thank the American Cancer Society for their tireless advocacy on behalf of the bill and the information and perspective they provided to us. Through conversations with stakeholders like them and the New York Health Plan Association, we were able to come to a compromise that satisfies all parties. While this is a step forward for treatment and medical equity in New York, there's more that can be done to reduce the danger of kidney diseases and cancer. We need to conduct and fund more research to learn more about the causes and treatment of kidney diseases. There's much we still do not understand about rare kidney diseases, but it's essential that we also continue to conduct outreach programs and raise awareness, as we are doing right now with Kidney Action Week. I'm committed to the cause and will keep advocating to support kidney disease and cancer research, treatment, and prevention. Thank you.
We are thankful to Assemblymember Hunter for her work and leadership on this issue. We were really happy to see progress that occurred, and AKF was highly motivated to make that happen. So we're very happy that we've passed a bill in New York State. Next, we have a video. It's a panel discussion with myself and Dave Galbensky, who is a living organ donor transplant advocate from the state of Michigan. Everyone, I want to introduce you to my friend Dave Galbensky from Michigan. This is the What's Happening in the States session. I want to give Dave an opportunity to answer. I've been working with Dave in Michigan now for a couple months, almost feels like a year, and I wanted to sort of let him tell his story about his journey through advocacy. So Dave, thanks for joining us. We appreciate it.
Hey, John, happy to be on. And it's been a pleasure working with you guys in the state of Michigan as we try to, knock out all those 7 criteria, right, of the American Kidney Fund's criteria that rank states. It's a very powerful tool. And I got involved in the advocacy space very simply. I was a transplant recipient, right? I am the grateful recipient of a living liver transplant, John. And my journey started about 10 years ago in 2013 when I was diagnosed with a rare autoimmune disease that attacked my liver, progressed over about 6 years, landed on the transplant list, and an angel on earth appeared, my brother-in-law, to donate a portion of his liver to me that saved my life about 4.5 years ago. That would have been November of 2019. And so going through that journey, we realized there were some impediments, particularly in the state of Michigan, to allowing living donors to step forward. And when I came across your great tool that ranks states on A through F on 7 key criteria, I found out our state was an F. And as a Michigander, lifelong, knowing I just went through it, I was like, man, my living donor had to face some challenges that he didn't need to face, how do we eliminate them? And that was my journey to advocacy.
What's been the most rewarding part about all this for you? You've been doing this now probably since your transplant. What's been the most rewarding part for you?
Really honoring the gift of living donation. So honoring my brother-in-law and all living donors and putting myself in their shoes. And then when we think about it, it's participating in the legislative process as a citizen. How much greater impact can we have to take something we're passionate about that's life-changing and pay it forward? So it's creating those personal connections at a very real level that we know will help save the life of another. That's paying it forward. And I'm very grateful that I get that second chance at life to pay it forward. And then hopefully, as that next living donor steps forward, they have less emotional impact, psychological impact, and financial impact to say, let's go. Let me do it and save a life.
Dave mentioned it. We were talking about the Living Donor Scorecard, and in Michigan, it's been really, really effective. The story about changing a grade and trying to go from an F to a C to a B to an A, it's been really, really motivational for a lot of legislators. So it's been great for us to really talk about that in all of our efforts.
It really has. I mean, you talked about, how do we message it? From day one, we were using a very objective scorecard, yours, and it allowed the legislators to focus in, see where we rated amongst our peer states. Because what I've learned in advocacy is oftentimes they're looking at peer states that maybe are geographically similar or similar in other ways, and they want to see how they compare. And it's a motivating factor to say, we got some work to do to catch up to our peer states in the case of Michigan. And it motivates them. And we love having objective criteria, and then we love knowing what other states have enacted it so we can really paint a compelling story, John.
And Dave did such a good job the last time we testified together. There was a member on the committee saying, what else can we do for you? Are there any other things we can do for you? So I can't get any better than that.
Yeah, that's a great leading question, right? You're like,
right.
Well, let me tell you where we're heading. Thank you for asking.
Thank you for asking. So along those lines, what advice do you have for someone, and there are a lot of people who are listening to this today will be in this boat, who are curious about advocating at the state level, haven't done it before. What advice do you have for them for their first time trying to do it?
Yeah. So here's how I approach it. I always share experience. I would go to a legislator and say, hey, I'm a transplant recipient. So I get in the game. Put yourself in the place of most potential, right? Which is a conversation with your own legislature or someone you run into. So place of most potential first. And then I'd tell them my story a little bit, but then I'd say, here's where I'm at, what I know about legislation. And I'm 54, so that may resonate with some people in the audience. There was a great thing called Schoolhouse Rock called I'm Just a Bill. So I used to have fun and just say, I learned all I needed to know about legislation, or all I know today about legislation from Schoolhouse Rock, that song, I'm Just a Bill, and I'd sing a little ditty. And then I said, hey, you know what? Also, the state of Michigan puts out this amazing guide for high school students on how to get a bill passed. So I picked that up and I read it, all 18, 20 pages. I'm like, that's what I know. But I know there's a lot more. And it starts with you. Can you help me understand how I can educate you on an issue that I'm passionate about, that I think will save the lives of Michiganders and will be a net contributing factor to our state? And there's no better policy to be involved in than supporting living organ donation, right? And so that would be the dialogue. And, for me, putting myself in the place of most potential was heading up to Lansing, our state capital, and literally just starting to talk to people, engaging in the process. Because what I've found is on this issue, if it's approached appropriately, there will be the respect to listen, there'll be the respect to understand, and then it's just going to come down to what the political climate is in the state on, are they going to move it forward or not? But they'll listen, they'll be respectful, and when we do that, John, even if we're not successful in getting that piece of legislation advanced, we've created awareness. Awareness saves lives in and of itself. So I always look at it and say, what's the worst case scenario? I've had a conversation with someone that is going to be in touch with a lot of people, and they're going to be more aware of living organ donation just after that conversation. Put that one in the win column, and then if we can advance legislation beyond it, that's where we're getting the policy change that we're seeking.
I think that's great. I want to summarize that into 3 small areas. 1, by nature of who you are, your story is valuable. So even without any other information, you showing up, telling your story has value that other people can't bring. Two, no matter what happens, the legislator or whoever you're meeting with, if it's staff, has more information on your topic than they had before they had this meeting. And to Dave's point, they talk to people. They are going to go, that information will spread in a way that it hasn't before. And three, if you don't ask, you don't get. You have to make the ask of what you'd like that legislator to do, how they can improve the problem that you're talking about. And that's the case for your first time lobbying, and that's the case for your 1,000th time lobbying. That's still the process over and over and over again.
Absolutely.
And I want to talk about testimony. So again, I've had the good pleasure to testify with you in person. I think it was 2 weeks ago. Time blends.
Absolutely, yeah.
But you have been doing this for a while. I think you do a great job. Just wanted to get your thought process behind sort of how you prepare it and what you think is most important to impart.
Yeah. So I kind of put it in 2 or 3 different categories, right? What am I going to provide for written testimony that will go into the record? So I'm very, more comprehensive with written testimony that goes in the file. I think most states will have that legislative history tied to the committee meeting. So in the case of our latest testimony, I had a document that had a lot of supporting information that they could refer to, but I wasn't going to testify to it, but I wanted them to have it in case they needed it. And some of the components of that, John, was a lot of the American Kidney Fund, peer state ratings, a lot of things that we had done. So I put together a comprehensive deck for them pre-testimony. 2 is I also worked with other people to see if they would put in cards of support. In Michigan, it's called. Ask them to come testify or put in support even if they don't want to. So that's kind of the prep going into a committee testimony hearing. Now, in terms of the testimony itself, just some tips. Try to be concise. I listen to other people's testimony. Even if I have my script, I'm not going to try to be redundant. If other people that are testifying with me, I don't need to repeat the same amount of people that are on the transplant list. I don't need to repeat other arguments. I just need to hit my story. As a transplant recipient, or when my donor would testify, my brother-in-law, Mark, we would share our personal story, emotional connection first. Of course, greet the chairperson, share your emotional connection to open them up to understand that they're dealing with a very real issue that we're trying to solve. And then I'd hit them with more of the logic. So emotion, share their own personal journey. You can own it. They're going to connect with it, and then gets into the policy that you need. And know where you are able to stop, where other experts can lean in, right? Because we have our stories, we have our own expertise, but certainly in health policy, nuances, individuals like you, John, come in and you have the national landscape to allow them to have the comparative scenario. So I'm very clear there. And then I like to end with what I'm asking them to do, which is, in this case, these literally are life and death votes. So not to overstate it to them, but say, this is a vote you're casting to get out of committee that literally impacts lives when this legislation is done. So try to appeal to their emotion there on the gravity of it. And then, of course, thank them. And then know where you can answer questions and know where you can defer. And what I've learned over time is they may have some very specific questions that maybe no one on the panel can answer at that time, but they're okay if they say, I'm good if you get it to me after the committee hearing. So those would be some, very practical tips. And one last one. I'm 54. I don't yet use reading glasses all the time, but practical tip. Print your testimony in larger font. It's okay if you have multiple pages so you can see where you're at. And 2, another practical point, know how to turn on the mic before you go up there, because most times there's a mic on, off. And I've seen people come in, they're not prepared, they don't have large enough font, they don't know the microphone, and it takes away from some of that. So just be cognizant of what you're going into, practice a little bit, and have fun with it. You're there to learn, you're there to share your story. And I haven't found a single legislator that's going to try to grill me. Nope. They just want to learn. And so there should be no fear. Share the story, have some fun, use it as a learning vehicle. And there's a few practical tips as well on testimony.
Folks, I hope you took notes. That is everything that I would ever tell you about testimony. And that's a master's level tip that Dave said about making sure that if you're on a panel and you don't present first and other people are saying what you say, not repeating what someone had already heard, saves you time, lets you take your time on the other part, your story that can't be replicated and hasn't been said already. And it just, if a panel of folks committee members are listening to 10 people testify over and over again, they start to tune out after a certain period of time. So that is a great way to make yourself stand out and a great way to keep legislators on your side by not boring them to sleep.
Yeah. And John, even if we think about our testimony, right? I mean, we're always up against a deadline of that committee hearing being done. And what was awesome is if people would have missed a couple minutes of additional testimony, we might not have got the result we wanted in one single session, which for us was great. We got the testimony in, and we got a committee vote out, which oftentimes doesn't happen, very rarely happens in a 1-2 punch in one meeting. So if we would have not followed that advice, which we did, we might have missed that window when voting members were there before they had to go to legislative session, which was happening 15 minutes later. So just being cognizant that each minute matters. And we got a big advance because of that.
Absolutely. That's a great lead into this next question. I met Dave, I think now, whatever it was, I think it was last year.
Yeah.
And one of the first conversations we had, he just said, I want to take us from an F to an A or a B, and I want to do it in one session. And I said, I don't know. That would be great if we could do that. But you have been dogged and really leading the way in a lot of this stuff. And I want to give you the opportunity to talk about the bills that you've already worked on. So we didn't actually say what this was that we testified on, but the success we've already had, and then what you're still working on here in the rest of 2024.
Yeah, happy to do it. And I'll be real quick on it. We had a big legislative win last year, which was on the insurance credit, which we are grateful to get through. That was our first step of legislation. So prohibits discrimination for life, disability, long-term care. So it creates one less emotional issue, financial issue for living donors. We started that bill last year. It was signed into law November 7th, ready to roll. At the same time, we saw on October 1st, the state of Michigan put in place leave of absence for public employees. So check box 2 right there. In one calendar year, we moved from an F to a C. Fantastic year, more work to be done. Our legislative session is 2 years, 23 and 24. What we've got teed up right now with an amazing representative, Rep. Brayback, who is just an amazing organ donation advocate in Michigan. We have the living donor tax credit bill, which will give a tax credit for a living donor up to $10,000 for lost wages, travel, lodging, and childcare expenses. And that's moving through. It's been through the Tax Policy Committee and is now going to the House floor. We expect a vote in the next 2 to 4 weeks on the House floor.
Next Tuesday is supposedly the one so very soon.
Yeah, exactly.
The day people are hearing this is the day we hope to have our floor vote.
Yeah, so it's coming quick, and then we'll work it through the Senate side. And again, election year, we're hoping to move it through as quick as possible to get it done before campaign season hits. So that's the next one. So that, I think, John, may move us almost to the B. And then we got one more piece that we're going to try to get through, which is the employer tax credit side. That's the one that is probably only got 4 or 5 states, I think, right now. So we're going to push hard, but that is on the employer side to bridge that gap. And I won't go into all the details of our verbiage, just bridge that gap between when the private employer's leave of absence stops and say 12 weeks, where the state would issue to the employer a tax credit to cover those wages. So the living donor has 0 lost wages during a 12-week period, and we filled that gap. So we get that through. John, can you tell them the news that probably has never been done? So we're hoping to celebrate with the Brayback bill to get to a B. And then if we get the extra credit of the employer tax credit, what would that be in one legislative session for the first time ever?
That would be an A, from an F to an A in one session, which has never been done by any state since we've been tracking it. And for those of you, if there's any Michiganders who are listening to this, our plan is to have an in-person event in September, bringing advocates across the state to come to Lansing to testify on these bills and some more. So keep your eyes peeled for that if that's you. But it has been a busy session with more wins than either of us probably could have. Well, one of us predicted it, but either than any of us could have really realistically expected. It's been fantastic.
Well, we're so grateful to have you guys involved, to have built the platform. John, it's amazing. Use the tool that you guys have created. It's powerful. And let's get wins all across the country. Because if we build momentum at the state level, John, I know what you guys think is that's going to build momentum to finally get some movement, right, on the national bill, to get a federal bill in that then says we've achieved what we wanted, which is let's let living donors be the heroes they are without any friction to save the life of another human being. So let's get out there, guys. If we've been involved in it, let's make it happen, because that's what's going to bridge that gap to ensure, what are we trying to do? Make sure no one on the transplant list waiting for a kidney or liver dies before they get access to it. And we have it in our power to make that happen.
Thank you so much for your time, Dave. I hope I'll be seeing you soon once again. We're going to get all the way to that A. That's our plan this year. Thank you so much.
That's the plan, baby.
Take care.
Awesome. Take care, guys.
Thank you to Dave. If you're not charged up after listening to him talk how to do this, I don't know what to tell you. He's fantastic. I love working with him, and I'm looking forward to continuing that work in Lansing the rest of this year. All right, so let's get into the issues that we're working on from state to state. Ari's going to walk through what our major issues are that we work on in most of the states that we're in.
Thanks, John. So I think many of you are familiar with the key issues that we pursue across the states, maybe because you are familiar with our work or because you just listened to Dave kind of quickly run through a number of them. But there's also overlap with some of our federal issues. So you may have heard of some or all of these. We largely focus at the state level on living donor protections, especially those listed in our annual living donor report card. Access to Medigap supplemental insurance for people under 65, and then biomarker testing, as was mentioned earlier. So just to quickly review, every year we put out our living donor report card and we rank every state in the country. We look at 7 types of living donor protections that we try to pursue across the states, from insurance discrimination to the time off for organ donation leave that John and Dave were just kind of talking about. So while our federal team pursues passage of the Living Donor Protection Act on the Hill, we pursue passage at the state level, and we've seen a lot of really exciting wins. I believe 33 states have passed a version of the Living Donor Protection Act at the state level, and John and I continue to work to increase that number. With respect to Medigap coverage, you may have heard of Medigap supplemental insurance. It's just that. It's supplemental additional insurance coverage that helps cover that 20% of costs that Medicare does not cover. And it's particularly important for folks under 65. Well, we believe that it's particularly important for folks under 65 to ensure that they have accessible and affordable Medigap supplemental insurance coverage, right? Because some insurers at the state level are able to charge someone under 65 more than what they would charge someone over 65. Or they can also opt not to offer certain policies to certain populations. So again, we really believe and are pushing for accessible and affordable Medigap coverage for everyone, but particularly those under 65s who may be excluded right now. Also important to note that Medigap supplemental insurance is a secondary form of insurance, which is really, really important if you want to get on a transplant waiting list. Usually you'll have to prove that you have some sort of secondary insurance. So not being able to access Medigap coverage or another form of that secondary insurance can actually preclude you from getting on the transplant waiting list. And then finally, biomarker testing, which we kind of went over really quickly. Right, biomarker testing is a process that involves analyzing someone's tissue, blood, or other biospecimens to determine treatment for them, to maybe diagnose them, or to better understand the likelihood of them developing a certain disease or condition. So this is frequently used in the field of oncology, but research is kind of building ground every day, and we're really hopeful that we will learn more and more about the causes of kidney disease, and that biomarker testing will help folks better understand their risks for kidney disease, right? So in some states, insurance providers are not, insurance providers vary at the level of coverage that they offer for biomarker testing. And we've been working kind of with a coalition of other patient advocacy groups to support access to biomarker testing for everyone, especially as that research progresses.
Next slide. So where are we doing this? We're active in many, many, many states. Maybe you see your silhouette of your state here. Maybe you don't, but that doesn't mean that we are not interested in working on your issues, or maybe your states are already an A, and we're just sort of prioritizing and focusing on states that are in the F and the D category on our scorecard. So let's just sort of look through these living donor protections. So this encompasses the LDPA that Ari mentioned. It also encompasses the bills that Dave was talking about: tax credits for employers, tax credits for individuals who become living donors. So if you're looking there, you've got Massachusetts, Michigan, Mississippi, South Carolina, Virginia, Vermont, New Hampshire, and Rhode Island, all working on living donor legislation. Rhode Island is an interesting one this year. We've got many bills going. Last year, we passed living donor protection, so the anti-discrimination on insurance bill. This year, we have a leave bill for public sector employees. We have the tax credit bill, and we also have Medigap. So Rhode Island, very, very, very active. So if you're in Rhode Island and you're interested, please contact me. We would love to work with you. But the rest of these states, both Massachusetts, Mississippi, South Carolina, New Hampshire, and Vermont, all have that LDPA, that anti-discrimination bill, active. Some of them are further along than others, but we're feeling very good about our opportunities in all these states. So again, as I bring these states up, if you live there and you want to do more, please reach out to any of us on the team. You can reach out to Ari or myself, or if you know someone else like Ben, most of you know Ben. If you know Ben, reach out to Ben, and we'll go from there. Michigan, Dave talked through the things that are going on there. Again, F to an A in a year would be amazing. F to a B is amazing, and we're really excited about the forward progress there, and excited too for the September fly-in, which is our first state fly-in that we've done in quite a few years. So very, very excited to see how that goes. Medigap, Ari already talked about, why that's important, why we work on it so much. We've already passed it so far this year in Indiana. We're very, very excited about that. This is the second year the bill was active, and we were able to move it along very, very quickly due to great work by advocates, great work by our sponsors, and great work by coalition, all the organizations that were in coalition to pass these bills. So that's great news for people in Indiana. You're going to be able to get much more affordable Medigap access if you're under 65 with end-stage renal disease or ALS. Georgia, we attempted to pass it this year. It's going to be a multi-session issue, I think, in Georgia. We're going to be working on that. Michigan also will be introduced here in the next coming weeks, hopefully, maybe months. That was going to be another thing we're working on over multiple years. Ohio and Nebraska are active. Nebraska is a bit of an interesting case. Nebraska is a bill that I think already passed yesterday, potentially. Has not been signed by the governor, but ESRD, so our folks are not included in that bill. That has happened in a couple other states. We passed Medigap in Virginia last year, but before last year, that was a state in which there was a carve out for ESRD. So if you had kidney disease in under 65, you couldn't purchase, but if you had ALS or disability, you could. So now that's been remedied, but Nebraska is the latest front in us trying to make sure that there's parity in that under 65 community, that both ESRD, ALS, and disability, which are the three groups that are eligible for Medicare under 65, are eligible to purchase Medigap under 65. So Nebraska is one to watch. We're trying to get involved there. Biomarker testing, we just have Pennsylvania and Florida here, but there are many states that are working on biomarkers. We are involved in quite a few of them. Last year, I think there were 13 that passed across the country. It's been in the states. Over the times that I've been doing this, you notice there are large-scale trends that move nationwide. So an issue becomes salient, and then they get introduced in a bunch of different states, and you see a big wave across the country of things passing. Last year was the beginning of that wave, and now this year the wave continues, but the resistance to that wave is a lot more robust. So we're finding that it's not quite as easy to pass it as it was last year. We continue to try to work on that. One of the things that we've been seeing is insurers trying to make sure that only people with cancer are eligible, or only Medicaid patients are eligible, not people insured on the public market, or private market rather. I'm sorry. So that's something we continue to work on every day, try to make sure that as kidney disease biomarkers are developed and understood and approved by the FDA as clinically viable, we're making sure that those are covered under any insurance plan that you could potentially get. So I want to go through a couple questions. I think we have, I want to remind everybody, we have a few minutes left. We have quite a few minutes left for questions. So please be sure to answer or put any questions in the chat, and we'll try to get to as many of them as possible. We have a few already have come in. One was, will the employee tax credit be retroactive and for donors? So I'm guessing that's on Michigan specifically. The Michigan employee tax credit will be for, it's an employer tax credit. So if an individual, you work for a private company, they don't offer any paid leave for you to become a living organ donor. Because of this tax credit, they will be able to offer you paid leave. The employer will get 100% of the costs of your wages while you're on paid leave back in the tax credit, and will also get funding to cover your replacement in the short term. Your job is still guaranteed when you come back, but that would be the mechanism in Michigan. As Dave said, not a lot of states have passed that. We have a similar bill in Rhode Island. We had a bill this year in Virginia. It's something that we're trying to see in more places, just because there's a big gap for people who unpaid leave is great. Paid leave is better. People, that's a financial burden that could potentially get in the way of you deciding to be a donor. And then the donor tax credit is eligible it's not passed yet, but it's still moving. It's eligible in the year before you donate, the year you donate, and the year after you donate. So the idea there is the process for becoming a donor can span some amount of time. It could be, so if you were in November, started to do testing, started to travel to be able to make sure that you're able to donate. We wanted to make sure that all the expenses were caught. So we added shoulder years. The amount is still the same. The tax credit is $10,000 for non-medical expenses, but the time at which you could claim it expands. That's new. It's never been done in any other state, as I am aware of. Something that we may consider replicating if the bill passes, but that's sort of the structure in Michigan on those bills. We had another question come in about Texas, and I want to have Ari take that. But does Texas have legislation that helps chronic kidney disease patients?
Yeah, so Texas is in legislative session every other year. So they are not in session this year, but they will be back in session in 2025. Last session, so 2023 session, we were monitoring a couple of bills there, namely Medigap coverage bill, HB 1803, I believe it was. And we're hopeful that that bill will be filed again and will be back in session in 2025, and we'll be able to take another stab at it.
We got another question coming in about Ohio and wondering about our Medigap efforts there. So what is the current situation for ESRD patients in Ohio with Medigap?
Yeah, so Medigap in Ohio is not terribly accessible. We do have a bill that we are working on with our partners at ALS and DPC. And that bill, I'm blanking on the bill number right now, but that bill, 399, HB 399, or nope, I'm sorry, it's HB 400. That bill is working its way through the process right now.
So Ari had the number wrong, because HB 399 is a tax credit bill that we're also working on. So exactly. If you plus or minus one, you're still on a bill that we care about. But I think the big thing to focus there in Ohio is the difference is going to be a premium protection. That's where we've been working in every state that we passed Medigap. The most important thing is to make sure that it's affordable. In a lot of states, some plans are available for under 65 with ESRD, but they can charge any amount for them that they want. So oftentimes we see over 65, affordable, $120, $150, $175 a month. And then under 65, because there's no regulation on what can be charged, you see $300, $400, $800. In Georgia, you see $2,000, $3,000 a month for Medigap coverage. So clearly, without premium protection, where it's actually affordable, access is somewhat irrelevant, because if it's not affordable, it's not accessible. We'll hold up for a few more if we have any questions here before we wrap, but I want to thank everybody for joining us today and hearing about the work that AKF is doing in the States, hearing from some of our champions in the New York Assembly, and also our great advocates in Michigan. But if we have no further questions, you can always reach out to myself or Ari. Our email addresses are jhoffman@kidneyfund.org and aholland@kidneyfund.org. You can find us anywhere. We hope we have one more question. We'll get that in. What about Maryland for donor protection and Medigap? Not really. Medigap, I believe, is we don't have a bill this year in Medigap. We haven't had one last year. Donor protections, I think if you look at their score, I believe they're a B, I'm pretty sure. But the thing I think we're working on right now is there's a biomarker bill to make sure that if you undergo biomarkers, whatever you find in that study, you're not discriminated against by your employer, or employers cannot force you to get a biomarker screening before they employ you as a condition of your employment or as a condition of your insurance coverage. Sort of a perverse incentive. We've been talking about expanding coverage for biomarkers. This bill was the first where we were somewhat concerned about making sure that the information gleaned from those biomarkers are not used against you in a way that it harms your employment, harms your employability, harms the money you can make. So we're working on that as well. So we'll wrap it up there. Again, reach out to us anytime you have a question. Thank you, Ari. Thank you, team, for putting this together. And this concludes our session. Ari, you want to kick it to our next session?
Yeah, sure. Our next session is Unsung Heroes in the Kidney Community, and that will get started at 1 p.m. So be sure to join us for that and for other Kidney Action Week sessions throughout the week.